Hi, I'm Brian Berman. I'm from Miami, Florida, and I'm speaking to you from Hawaii. And I just gave a lecture on what's new and hot in medical dermatology. I touched on a few things, including what's new with actinic keratoses, tibionibulin, ointment 1% cream has just been indicated by the American Academy of Dermatology to have the highest level of recommendation for the treatment of actinic keratosis, as well as having the highest level of certainty of the evidence that the recommendation was based on. This is unique among all the other topical therapies for actinic keratosis, having the strongest recommendation as well as the highest level of certainty of the data that was used. Other areas I discussed is that tirbanibulin, according to the FDA, comes in a 250 milligram little packet, and it should be used to treat a 25 square centimeter area. Now, that's not a clinically relevant area. We looked at how far one of those packets can actually cover, and we found that it covered over 300 square centimeters, which would be enough to treat a whole scalp and even a little of the face. We also discussed um, molluscum contagiosum. There are two new agents that are on the brink of being reviewed by the FDA. One is berdazimer, which contains a nitric oxide releasing factor. And nitric oxide is antiviral, and it's able to actually bind to some of the proteins that are inhibitory to the immune system, allowing the molluscum contagiosum virus to hide from the immune system. And then by binding to these proteins and inactivating them, then your immune system can get rid of the molluscum. In one study, at the end of the study, about 32% of patients were completely clear of all their molluscum contagiosum lesions. In addition, there was another agent. I think we're all familiar with canthrone that has cantharidin, which comes from the blister beetle. And now there's a purified cantharidin, 0.7%. That agent was also studied for molluscum contagiosum, and at the end of the study, about 50% of the patients had 100% clearance of all their molluscum contagiosum. One other last thing we discussed was keloids. As we know, the recurrence rate after surgical excision of keloids is about 70% of the time. That's bad news. Using superficial radiation therapy for just 3 days on postoperative day 1, 2, and 3, the recurrence rate dropped from 70% down to about 10%. So those are some of the things we discussed recently in Hawaii. Aloha.